Hey, welcome to the channel. It's Jack, the muscle and mobility maker with Stronghold Strength and Conditioning. And today, we're going to be talking about lower back pain with anterior pelvic tilt. But before we get into it, make sure you take a moment and hit that subscribe button so that you don't miss out on future content like this. Every Saturday, I'm putting out videos showing you how to resolve aches and pains, prevent injuries, and overall optimize your performance inside the gym and outside of it in your daily life and routine. And it doesn't get better than that. So take advantage of it. Ready? Let's go ahead and dive into this one. All right, like I said, today we're going to be talking about lower back pain with anterior pelvic tilt. So first of all, to identify if your anterior pelvic tilt is truly giving you lower back pain or causing you issues, it's important to understand that pain that you're usually going to get over that low back is going to be across the lumbar spine altogether in more of the musculature, and it's going to feel more stiff or locked up or restricted across the lower back. So it's almost an aching or fatiguing feeling to the lower back. And oftentimes this is because this is where our body is stabilizing from. If we're doing a lot of walking or we're on our feet a lot, it's going to draw out that lower back pain and exacerbate it or cause it to come out even worse. So that is where we tend to see a lot of lower back pain, or it might come out if you are squatting and you have poor control over your pelvis there. Every time you squat, you're loading that lumbar spine a little bit more, and that's going to cause you to have a lower back pain with your squat from that. Eventually could become a bigger problem. But those are the things that will generally draw it out, or it might just be there if you are constantly stuck in that position and it's an aching, nagging thing at this point. So if that's your pain, this is your video. What we're going to do is a mobility-based approach to help you resolve this. So we're going to address the joints that are important. We're going to look at some soft tissue work to open up flexibility and improve the quality of those tissues. And then we're going to stabilize around it. Now, it's also important to note that anterior pelvic tilt can be a full systematic problem. So if you are flat-footed, your feet turn out, you have any injuries down at the feet that have caused you to avoid rolling through your toes the way your foot should, then that can cause, if your arch is collapsed, you to have a prone position that is going to be that anterior pelvic tilt. So it might take some corrective work at your feet as well, building upwards, strengthening the hips and improving around the hips as well, and then learning how to truly brace and stabilize your core well. So there's a lot of stability to be considered as well when you're looking at anterior pelvic tilt that we'll also touch on and address here at the same time in our approach. Ready? Let's go ahead and take a look at it. All right, like I said, the first thing that we want to pay attention to is how your feet are. Are they unstable? Do they need some work? So here we're going to start to build some stability and strength back into your feet. The first thing I'm doing here is a passive toe splay, but I'm also using a contract and relax method to help me get deeper into that splay. So what I'm doing is interlacing my fingers with my foot. I'm going to squeeze my toes over my fingers. So I want to actually squeeze my fingers with my toes as strong as I can. And then on the relax of that flex, after about 5 to 10 seconds of flexing, I'm going to try and get my fingers a little bit deeper into that interlace. So I'm really trying to get into that webbing as much as possible and create as much space between those toes passively and make that splay as wide as possible. We want surface area for our feet, and we need toes that function individually here. So this is how we're going to start to restore that and build strength in that arch. Next, we need to be able to isolate out extension of our toes. So here I'm going to extend the big toe and then extend the small toes, alternating between the two. So here, just parallel the feet up. Start by extending the big toe and then extending the small toes. This might feel a little bit awkward at first. You might feel like you have zero control over it, and that's really what we're trying to take back, okay? So we want to feel about 3 points of contact on our foot on each side when we are standing there doing this exercise. You should feel the first metatarsal behind the big toe. You should feel the 5th metatarsal behind the small toe, and then you want to feel the heel as your tripod. Next, we're gonna do a little cat clawing. So you're gonna reach out with your toes as wide as you can, spread them out as if you're reaching down the mat, and then you wanna drag the mat back toward you. You could actually see my mat curling up as I do this. You can do this with a towel if you want. You can play with carpet, whatever you wanna do to get some resistance on those toes as you're dragging back. That's what we want. All right, and the last one for our feet here, we're gonna do a little pin and fan. So I'm pinning my first metatarsal down behind my big toe, and then I wanna try and fan out as wide as possible away the rest of the toes. So it's keeping that first metatarsal pinned in place, externally rotating at the hip and reaching with your smallest toe as far as you can away from that big toe. You can see I have some pretty good spacing between my big toe and that second toe, and it gets a little bit narrower as you go out, but you should still see some space between those toes as you spread. As your splay gets better, this will also get better, but you should notice the arch of your foot working quite hard to do these. All right, now we're moving up to the hip. Anytime we work the foot, we also want to be working the hip. The two have a synchronous relationship to one another, so they are working together at all times. Here I've got a band anchored at just above hip height, and I'm going to place it over my glutes. The first thing I want to do is step back as deep as I can with both legs straight, and I'm going to actively go into anterior and posterior pelvic tilt. So I want to do a few reps here, and this is a progression. These might take time to really develop, just understand that. Once I have that, I'm going to be flexing and releasing the glute while I'm holding a posterior pelvic tilt. So I have my tailbone tucked a little bit, and now I'm working on the control of my glutes. The last piece I'm going to add is a lunge. I want to go into that depth of the lunge, and you can play with a few anterior and posterior pelvic tilts in the bottom position, but the key is that we're able to maintain the glute flex through the full lunge, and you should see your knee sitting behind your hip if we have full extension. If we lack extension of the hip, my lumbopelvic region is going to compensate by creating that anterior pelvic tilt. The second way we're going to work at getting that extension back is through what's called a couch stretch. So we're going to go up against a wall, drop one knee in the corner, and at level one, we're going to start with one foot out front, both hands in line with that front foot. And we're going to start with a flex of the glutes. Again, contract and relax. What we're trying to restore is your neurological control over the stabilizing muscles around your pelvis. So we want to teach your body how to tuck the pelvis using the glutes, get the hip into extension, and truly restore extension so that your lumbar spine doesn't have to compensate for the missing hip range of motion. As you get more confident in level one, you can move up to level two, which will be up at the knee. The key here as we go more vertical is being very conscious of your anterior pelvic tilt and actively posterior pelvically tilting so that you can get that tailbone tucked, get the glutes engaged, and make sure that you're not arching your back, especially as we get into this upright position. Now you'll see me actually playing with anterior and posterior pelvic tilt here in the vertical upright position, and that's going to help me restore, again, control as I have full access to range of motion. This is something that's going to take you time to build up, but just know that this is the progression you want to work for, from the floor up to the knee and eventually to a full back to wall position with control over that tilt of the pelvis. Next, we're going to work on flexibility of your adductors. Our adductors tend to be very tight muscles. They hold a lot of tension often because this is a place where people can hold stress tension, but also with that structure of the foot, if it's been collapsed for a long time, there are going to be some tight muscles here because the whole system of the leg has been caving inward in internal rotation. So what we're going to do here is called a loaded butterfly. So you do want about some 25-pound kettlebells or plates or dumbbells, whatever you can use. I recommend a dumbbell or a kettlebell because they're easier to just kind of sit and hold there. And what we want to do is place them on the inner thigh while your back is against the wall, butt to the corner, and the soles of the feet facing one another. We're gonna start by flexing up against those kettlebells for 5 to 10 seconds and then relaxing and allowing the weight to passively open my hip adductors here. So that is where the stretch is gonna come from. We're going active and then passive, allowing the range of motion to increase. What you're seeing here is that my range of motion is getting closer to the floor, and you should see it happen with yours as well pretty immediately after that contract and relax. It might not get to the floor right away or immediately, but it will eventually get there with some practice as well. And this is going to help open up an important piece of external rotation at our hip, which we'll talk about more here in a second. All right, hip external rotation. Here we're trying to open it up through a 90-90 sit, and it can be really helpful to interlace those fingers with the toes and place the other hand on the knee so you can keep that front leg pinned in a good position. We want it to be perpendicular to our body here so that you're actually leaning across that calf, thinking of reaching your belly button over the shin. So we want to keep some length as we lean in here. Your hips might try and cramp. Do not shy away from the cramping. Just embrace it, flex into it a little bit more, and continue on as if it's not happening there. That's going to help you strengthen those weak hip flexors, those weak hip internal and external rotators that are trying to help you stabilize at this point, but need a little bit of attention. So from that 90-90, you can start by assisting your lean, and then from there, opening up with the arms fully back. The full progression, if you want to increase this stretch even further, is to extend that back leg behind you into a pigeon stretch and work your external rotation from there. Again, this is going to help us with stability of the pelvis and the hip, and there's an important correlation between the movement of external rotation and stability around the SI joint. All right, and the last bit of soft tissue work we're gonna do right around that lumbar region in the thoracolumbar fascia, specifically targeting our QL muscles and our multifidi down there, is gonna be a lacrosse ball smash to those soft tissues. So I have a lacrosse ball below my ribs, above my pelvis, and I'm going across those tissues side to side, working the range from, again, below the rib cage to the pelvis, just trying to search for tenderness to the pressure of that ball. What I want to do is breathe and relax and trying to let that ball actually sink into any tender points that really stand out to you. So if it's uncomfortable, let yourself get comfortable, diaphragmatically breathe, and even your breath can be helpful. So as you breathe, breathe in and increase the pressure on the ball, and then exhale and release. If you need to increase the pressure from the ball, you can also take one leg in external rotation, putting it up over the other, and we're going to actually go across those fibers side to side once again. This is helping rehydrate the tissues and actually regain some neurological control in that area, telling them they don't have to hold the tension that they've been holding. So it's going to benefit us by helping us relax those muscles naturally. All right, and finally, we're getting down to the piece that might be the most important, and that's the stability and control. Here we're gonna work on active pelvic tilts, but what I want you to do is externally rotate and pull the lumbar spine flat to the mat as you pull the back of your neck to the mat, chin to the Adam's apple, and internally rotate as you actively anterior rotate your pelvis. So you'll see I'm arching when my knees are coming together, and then my back flattens out as I engage my glutes and externally rotate my hips. This is the hip and pelvis and lumbar spine function that we need to coordinate. It's something that we need to learn very well, because when our hips are internally rotated, our SI joint is loose and we have less stability at the pelvis. This allows us to control that better. All right, once you have good control over the internal rotation, anterior pelvic tilt, external rotation, posterior pelvic tilt, coordination, we're gonna add a band and a glute bridge. And we're gonna bridge when the hips are in external rotation. Again, when the external rotation of the hip happens, that's stabilizing our SI joint, which is locking in our pelvis and giving us more stability to bridge and work from. And this is where a lot of times back pain can occur if there's a slip at the SI joint or something along those lines where they're imbalanced. That can cause problems. So add that band, build in resistance once you have good control over those tilts. Actively go into that tilt with internal rotation, external rotation, flatten out, hip bridge, and then bring it back down with a flat back to the floor to repeat again. All right, and then once we gain some confidence and some strength from that supinated position, we want to take it to a half kneeling position and still coordinate the same movement. So when my knee is in and I'm internally rotated at the hip, I'm going to be in anterior pelvic tilt. When my knee opens up, I'm going to posterior pelvic tilt and tuck my tailbone. This again is going to be a little bit more challenging as we get into that hip extended position and we're working in a more upright position, but that is where we'll see progress overall in your posture and stance and your pain. And again, progressing this by adding a band, we can use some resistance and really build some strength around it. So the band is actively pulling me into that hip internal rotation. When it does, I'm allowing that arch of my back, again in anterior pelvic tilt, and then posterior pelvic tilting and externally rotating the hip at the same time to really engage the glutes and stabilize the pelvis. You should be able to recognize that stability pretty immediately as it happens. All right, and the last thing we want to finish with is connecting that stability that we built around the pelvis from the glutes to stability from the abdomen on the front side. So the glutes help tuck, but the abdomen also do by pulling short on the front side, bringing the pelvis toward the rib cage and holding that distance. So here we want to practice that abdominal contraction and isometric hold as we extend opposite arms and legs out here in a dead bug reach, going opposite arm, opposite leg. My back is flat to the mat to start, and as you get more confident and gain more control, you can do more of a neutral spine. So I start with pelvic tilt posterior, but you can always progress it to neutral as you gain confidence and control and restore yourself. Once you have confidence in that supinated position, then we're going to turn it over and go prone, and we're doing a similar reach. This is called a bird dog, so we want to extend the leg back fully and tuck the elbow to the knee in the middle and reach back out with the arm overhead. Now the key here is as you reach the arm and the leg, you don't overextend to the point where you lose that pelvic control and arch your lumbar spine. So you should feel your abs holding tight. You should feel your glutes engaging as you reach out, but you should not feel your back arching at all in this movement. Take your time, feel the stability between the arm and the leg that are planted, and drive through the glutes and the abs, connecting it together so that you're holding stable in that lumbopelvic region without much alteration other than that knee tuck to the elbow. It's good practice to come from flexion into an extended position without arching the back. All right, and there you have it. A mobility-based approach that you can take to help you resolve your anterior pelvic tilt, which will help you resolve that lower back pain that you're experiencing. You'll have a stronger core overall with better posture and structure to support your body in the work that you're doing. If you like this video, make sure you let me know by clicking that big thumbs up down below, and take a moment to share this one with a friend. If it's somebody that you know has anterior pelvic tilt, you've seen them walking around with that tilt forward, then that might be somebody that you want to share this with, because you can help them correct it sooner than later and not experience those issues. If you are somebody who's been struggling with this for a long time, you've tried multiple avenues of actually correcting it, and you are interested in having direct help and guidance fully resolving this issue, what I would like you to do right now is drop down below in the description to fill out a coaching application and schedule your mobility blueprint call. This is my opportunity to assess your current situation, talk with you directly, view how your body's currently moving, and develop a specifically tailored mobility training program specifically to your needs so that you can resolve this in a 12-week period or sooner. And if that sounds good, what you should do right now is drop down there, fill out that application form, and schedule a time that works best for you so we could get you moving in the right direction. Last but not least, if you have not already, make sure you take a moment and hit that subscribe button so that you don't miss out on future content like this. Every Saturday, I'm putting out videos showing you how to resolve aches and pains, prevent injuries, and overall optimize your performance inside the gym and outside of it in your daily routine. And it does not get better than that. Welcome to the Stronghold Army. We'll see you next week.